We're going to have Dr. Brian Weiss on, and he's going to be talking about, he's going to be talking about the next life. What happens after we die. And Stuart in Toronto, Canada, Fast Blast me. You can do that, by the way, up on the website. Go to Fast Blast and fire me a question. Art, I'd be really grateful if you could answer this. Afterlife. From what you've heard regarding past life experiences and people like last week's guest scientists weighing the facts, do you believe in the existence of afterlife or not? Thanks, Stuart. Well, hard question, Stuart. I'll tell you, I think I lean toward believing there is indeed an afterlife for a lot of reasons, most having to do with all the interviews I've done with very rock-solid people, like tonight's guest, I might add. I mean, if you're trying to figure the whole question out yourself, you might want to listen tonight, because that's exactly what we're going to talk about. This is a very renowned scientist who has sort of stumbled into this himself. Dr. Brian Weiss was doing some hypnotherapy, I believe, and ran into past lives. I mean, just boom. I mean, you're in the course of research trying to help a patient, and you run into something like this, and what do? Do you ignore it, or do you begin to explore it, as any scientist should, and figure out what in the heck is going on? That's what he did, and the results of his research are pretty astounding, so stay tuned. Coming up, we'll examine the probability of an afterlife with a man who's studied the subject scientifically, Dr. Brian Weiss. It is. Can you imagine being a scientist, a psychotherapist, regressing a patient or using hypnosis for treatment reasons, and instead of finding, the source of whatever ails the patient, running solidly into a patient's prior life, or perhaps a time he spent in between lives? I mean, as a researcher, as a scientist, as a psychotherapist, you would have, or you should have, insatiable curiosity about such an event occurring. That's exactly the kind of person we're going to talk to tonight. As a traditional psychotherapist, Dr. Brian Weiss was astonished and skeptical when one of his patients began to recall past life traumas that seemed to hold the key to her recurring nightmares and anxiety attacks, ostensibly the reason for her being there. His skepticism was eroded, however, when she began to channel messages from the space between lives, which contained remarkable revelations about Dr. Weiss's family and his own dead son. Using past life therapy, he was able to cure the patient and then embark on a new, more meaningful phase of his own career. Dr. Weiss is the author of several top-selling books based on his experience as a psychiatrist and healer. A graduate of Columbia University and Yale Medical School, Dr. Weiss is chairman emeritus of psychiatry at the Mount Sinai Medical Center in Miami, and he maintains a private practice in Miami. In addition, Dr. Weiss conducts national and international seminars and experiential workshops, as well as training programs for professionals. In a moment, Dr. Weiss. Folks, Dr. Brian Weiss, welcome back to the program. It's only been about 7 or 8 years or so.
Well, a little shorter than that, Art, but it's been a while.
Yeah, it has been a while. Anyway, great to have you back. And before we dive into the spectacular part of what we're going to talk about tonight, I have an observation that I'm sure many have made, and that is that in America, we have, I guess in the world, certainly in America, we have a lot of mental illness. And America doesn't have much of a system for handling mental illness. It seems like there must be a better way, and in your profession, I'm sure that you've given this a lot of thought. The mental health system in the U.S. seems to be a disaster. Do you have any thoughts on that?
Well, I agree with you. It's really done not in a compassionate way. And it's relied too much now on medication. Everything is turned towards that. As a matter of fact, many of the younger psychiatrists are very dissatisfied because a lot of them went into the field looking to talk with patients, to get to understand them, to help them, to relate at a deeper level. And now they're reduced to just handing out medications all the time without really getting to know them because they won't get reimbursed if they spend more than 10 or 15 minutes with the patient. So it really is in a state of disarray. It needs to change. It's not good for the doctors either.
Doctor, is there any way of your knowing whether mental illness is becoming a larger problem in America in terms of the numbers afflicted, or is it stable at a certain percentage of the population? And any thoughts?
Well, it really depends what illnesses we're speaking about. Probably schizophrenia is relatively stable, although I think some people have been overdiagnosed. But the incidence of stress-related diseases, depression, anxiety, panic attacks, post-traumatic stress disorder, these are going up because the world is getting to be so much more stressful, and we've lost a lot of our support systems. So when you have to really break it down by illness.
The numbers of bipolar people, for example.
That seems to be going up. I think for a couple of reasons. One, it's better recognized now. It's diagnosed more often. Before, people used to be just shuttled off to addicts. You know, the top story, I don't mean drug addicts, but addicts in a house.
I understand.
It would be hidden there. People would be lost in asylums. And so what's happening now is diagnostic skills have gotten better for that. But on the other hand, the pharmaceutical companies are so powerful and they make so many drugs for specific illnesses that these are probably getting overdiagnosed because the therapists think, well, now I have a treatment for it.
How effective are they, these drugs?
Some of them are. I mean, there's no question about it. For bipolar, lithium has been around for a long time, and some of the anticonvulsants are used now. But to just use the medicine without the talking therapy, without the increase of understanding that could come through that, I think is not good. It's got to be both in that case.
I guess that's sort of an ongoing almost war between traditional physicians and drug companies and psychiatry in general, huh?
It is. It's a very difficult situation for psychiatrists because they're kind of caught in the middle. And if they're intelligent, they usually get dissatisfied. They're not able to really relate and talk to their patients at a deeper level. The pharmaceutical companies are only interested in the drugs, and the government is interested in whatever's cheapest, which has nothing to do with necessarily the health of the patient.
So there we are. All right. Well, I guess I can't imagine what it would be like to be trying to help out a patient, and for this I'd like to take you back to how this began for you, because I guess that's where an interview like this should begin. I mean, to me, it would be astounding to be treating somebody for, I don't know, some anxiety they have or whatever, and to bump into something completely unrecognizable in the middle of hypnotherapy or some such. Is that, I mean, how did it happen? Lay it out.
It's kind of like you're saying, Art. I did not believe in past lives, and neither did the patient, who was a young woman in her late 20s, Catholic woman. And yet, when we were doing regression through hypnosis to go back to her childhood, to look for traumas that I felt might be causing her symptoms in the current time, she, under hypnosis, started to remember a lifetime about 4,000 years ago. Now, I didn't believe in this, and yet it was shocking because it was so vivid and so emotional and so detailed for her. She was seeing this visually, recalling herself in a different body, different name, drowning in a flood or tidal wave at the end of that life, somewhere in the Near East or the Eastern Mediterranean.
Doctor, do you recall what tripped this? In other words, as you were cruising along in whatever modality you'd be in at that time, I mean, something must have tripped this.
Absolutely. what happened was that the first time that we did this, she remembered some childhood traumas, but her symptoms remained severe. So the next week when she was in,